All right, so we are recording, Jen. On to you.
All right, so our keynote speaker tonight is Dr. Rishi Handa. Dr. Handa is an internal medicine specialist that's been practicing in Canada since 2017. He completed his training in New Jersey, where he was also chief resident, instructor of medicine, and cardiac rehab supervisor. He has offices in both Port Hope and Oshawa, and also works as an intensivist at Cobourg Hospital. His interests include general medicine, various metabolic disorders, and complex care. He has a large diabetes and obesity practice and also serves as a collaborating physician in the Port Hope Diabetes Center. Dr. Handa also has a passion for educating and speaks frequently for his physician and nurse colleagues. He also has received several grants to organize education seminars for patients directly. We'd like to thank you so much, Dr. Handa, for speaking for us tonight, and I will pass it over to you.
Thank you so much, Jen, and thank you all for being a part of this. I've had a chance to do this once before, I think once or twice before, and it's a fantastic event, and it's great to be a part of this community. I'm gonna actually start sharing my screen here, so just bear with me. Jen, if you can just give me a thumbs up if you can see the screen, the slides. Okay, great. So as the title says, and as my introduction was, we're going to be talking about adapting diabetes management during COVID-19. I know in this past year, you've probably heard many things, more than you've probably enjoyed about COVID. But this, I think we're hopefully coming to a point where things will start improving from this point on, but diabetes and other chronic illnesses are still here, and they're going to be with us for a while. So we're going to be talking a little bit about in the beginning how what diabetes is. I know you guys are probably very well educated about this, but I always like to do my little introduction about it, and then talk about what we can do, especially during COVID-19, to sort of optimize things and help with management. So we'll get right into it. A little bit about me. This won't take long. So internal medicine specialist, ICU. I think all of this was already shared, so I can just skip over. A little bit about you, though. So the folks that have joined on, some of you may have been newly diagnosed with diabetes. Some of you may have had it for 5 years. Some of you may have had it for more than 5 years. So the bottom line is everyone's in a different sort of journey at this point. Diabetes has changed so much in the last, I'm going to say 20, 30 years, even so much in the last 5 years. We've really come a long way from just insulin and certain pills. We have a lot of different medications that we can use, and management has changed. The biggest question is, do you understand diabetes and what the treatments are available? These are things that change so much. Nurses and doctors have difficulty keeping up at times, let alone patients. So it's ever so changing, and it's something that I have a passion for, definitely. The other question is, are you happy with your diabetes control? Some folks know about A1C, some folks know about fasting sugar control or sugar numbers, but controlled diabetes has a different sort of definition for everybody. And then, do we understand the recommended monitoring and screening guidelines? We won't be talking too much about this, but we'll get into it a little bit. So 2020, March 11th, the World Health Organization declared an outbreak of COVID-19, the coronavirus, a pandemic. I remember when this took place. I had just come back from a trip in Colombia, and I barely made it back into the country. The airports in Bogota shut down. And by March 16th, 2020, travel business restrictions were imposed by governments, including in Canada. We're sort of still in the same boat right now. The biggest thing, however, was doctors' visits, nurse practitioner visits, suddenly changed to virtual. So a lot of doctors changed their practice patterns. I myself never did virtual medicine ever. And I went from, seeing people in front of me, seeing blood sugars, holding their readers to practicing from my home office and my offices in Port Hope and Oshawa, but not having many patients actually coming in. So that's the biggest thing that changed, I think, for our perspective here. The next, I'm going to say 5 to 6 slides, maybe 10 slides are going to be about diabetes. I will rush through them because I know that you guys are experts, but what is diabetes? Your body needs sugar for energy. Diabetes is a disorder that causes a problem with this process, right? It disrupts the way that your body uses sugar. When you eat something, it gets into the GI tract, the intestines, the stomach, it's broken down into sugar. The sugar then gets into your organs with the help of a special hormone called insulin, which is produced by the pancreas. If there's a problem with insulin, then sugar builds up into the bloodstream, right? Arteries and veins. There's two types in general. There's two types of diabetes. There's type 1, where the body makes little or no insulin, and in type 2, where the cells of the body respond less to insulin, or the body just doesn't make enough, or maybe a combination of both. Exactly everything I just said is depicted in this cartoon here. Just for some folks that like to see. I'm not going to get into it, but in general, this little small diagram in the bottom shows types of diabetes, type 1 and type 2. What are the symptoms of uncontrolled blood sugars? For some, none at all. For some people, they can live without, live for years without even knowing, without even having a single symptom. It can start off as increasing the need to pee. That's when there's more sugar in the blood, gets filtered by the kidneys, and then this really sugar-rich urine gets sort of expelled from the body, and water follows. Increased thirst, similar mechanism, blurry vision. Why should people care if they don't have any symptoms? It's because if you don't do anything about it, you can have serious problems. And these are the list of things. This is things that we know about, we've heard about, and unfortunately we know, and we know people, and some of us have gone through these things. 1 in 10 individuals in Canada have died from diabetes related complications. Diabetics are 3 times more likely to be hospitalized due to heart problems from diabetes, and people are 12 times more likely, I'm just going to hide this dialogue here, sorry. No. Are 12 times more likely to be hospitalized with end stage renal disease or kidney problems. Life expectancy is reduced as well. We know that diabetics oftentimes live 6 years less than non-diabetics, and diabetics that unfortunately develop heart problems don't live 12 years less. It's a big problem. There's macrovascular complications, microvascular complications, and heart failure. So these are the various different complications that can develop. And then chronic kidney disease can develop if sugars are not taken care of. 50% of folks living with diabetes have chronic kidney disease. 50% of all dialysis cases in Canada are due to diabetes. And some really sad numbers here that that we all are familiar with. But diabetic retinopathy is the most common cause of blindness, legal blindness in people of working age. A1C, quickly, you guys have all heard of it, but essentially what it is it's a percentage of your red blood cells that get coated with sugar. So it's a percentage, and a percentage. What we look for as a goal is 7% or less for most folks. Improving sugar control, so reducing your A1C by 1% reduces your the deaths related to diabetes by 21%, reduces microvascular complications by 37%, heart attacks by 14%, amputations and peripheral vessel disease by 43%, and stroke by 12%. So this is why everyone makes such a big deal about your A1C. A1C targets, for the most part, 7 or less. In individuals that are at low risk for low sugars, less than 6, less than or equal to 6. elderly patients, functional dependent individuals, people that have unfortunately limited life expectancy, that can be, we take that into context, and an A1C goal of, for example, less than 8.5 is reasonable as well for those individuals. You guys have probably heard of the A, B, C, D, E, S's of diabetes care. A1C, the goal is usually less than 7. B stands for blood pressure goal of 130/80 or less. Cholesterol goal, you might have heard of LDL or low density lipoprotein or bad cholesterol. Usually that is, the goal is less than 2 or a 50% reduction. Drugs to protect the heart. Blood pressure medications like ACE inhibitors or ARBs, statin or cholesterol medications, aspirin if indicated, and medications like SGLT2 inhibitors or GLP-1 receptor agonists. So these are 2 new classes of medications that I hope you're at least aware of, have tried them, or are on them. These are very good medications that have been shown to be beneficial for both the heart, and some of these medications are beneficial for the kidneys as well. A, B, C, D is important, but not as important as exercise and healthy eating. Screening for complications is important as well. Smoking cessation. I always tell my patients that it doesn't matter what we do above. You don't quit smoking, all of the other things cancel out. So smoking is one of the biggest, it's one of the most difficult things to quit, but one of the most important things to address. Self-management, stress, and other barriers are obviously very, very important as well. We've already spoken about this, but how can I get diagnosed? So your nurse practitioner or doctor can check your levels. Hemoglobin A1C is a fantastic way. If you have a hemoglobin A1C of greater than 6.4, you can get diagnosed as a diabetic. Your fasting blood sugars, if your fasting blood sugars are elevated. There's also glucose tolerance tests as well. We commonly do these in pregnant women to diagnose gestational diabetes. This is important to mention that by the time you get diagnosed with type 2 diabetes, 50% of your body's ability to make insulin is lost. So, and that continues to drop for most folks. So you might be somewhere in between here, right? So between 5 and 15 years out, maybe 20, 30 years out, who knows? So diabetes is an ever-changing progressive illness that requires continuous optimization. So what you were on 10 years ago might not be the right thing for you now. So that's why your doctors, your nurse practitioners, your educators will constantly tell you about, hey, there's a new thing out. Did you hear about it? And that's why your medications are being shuffled so frequently. Treatment of diabetes. I'm not going to get into individual medications, but I do want to talk about just the classes. Your doctor can give you pills that help your body's insulin do a better job, pills that make your pancreas release more insulin, pills that makes your kidneys remove more sugar through your urine, injectable medications that are not insulin that helps your body's insulin do a better job, and then insulin. So those are your sort of 5 big groups of types of medications available for our type 2 diabetics. For type 1s, unfortunately, it's just long-acting insulin, rapid insulin, or insulin pumps. So now we're going to get to the important information to collect. We're experts with pandemics now, right? What have we learned? I think it's all, it's safe to say that medicine has pandemic medicine has some of its benefits, and then there's some things that we can't really replace with in-person visits, right? So for the most part, you always want to keep an up-to-date list of medications, right? This can be emailed to yourself. It can be emailed to your specialist or family doc or nurse practitioner, faxed, and just always keep a copy of your medications in your back pocket or in your purse. Sometimes people that are on blister packs, they can just print out the blister pack sheet, fold it up. If you have a smartphone, take a picture of it. But whenever you have a doctor's appointment, for example, I always ask my patients, some of my patients might wonder if I even pay attention to them. because I keep on asking them, what are your new, like every visit, can you tell me what are your medications? It's just my way of being up to date, because you might have been switched, you might have gotten on a new medication, and you might not have felt that it was important for me to know, but every single change in medication is very important. It might not be important, or you might not feel it's important to let me know, but it does make a big difference. Regular follow-ups. I know it might be difficult to get a hold of your family doctor or nurse practitioner. It might actually be easier to speak to your specialist, but it's very important to do your regular follow-ups. Don't ignore your regular follow-ups that you would normally do, pre-pandemic. At least you need to be seeing a doctor once, or your family doctor or nurse practitioner for your annual. Specialists like myself, we may see you more or less depending on your condition's control. If your diabetes is controlled, we may get away with not having to do blood work. We may get away with seeing you once a year. For the most part, I personally see my patients at least every 3 to 6 months. If you're really good and you have no problems, maybe a year. Regular blood work. I know this is one of those things that you might not feel comfortable doing. If it's felt to be important, and for the most part it is, you need to remember to book in advance. Unfortunately, with the pandemic, there are long lines at your labs, and oftentimes you need to book online or call. It's really difficult. It's challenging. Try to get a sense from your family doctor, your nurse practitioner, your specialist, how important is this blood work? Sometimes you might be surprised. It might not need to be done right away. And then the biggest thing to ask is fasting blood work really, really necessary? Or can you just do a random? Because obviously, first thing in the morning, the labs are jam-packed. For the most part, for myself, the only reason why I ask patients to do a fasting blood set is if I'm looking at their thyroid, or if I'm looking at their triglyceride levels, or very, very specifically need to know what their cholesterol levels are doing. If it's just their A1C or their sugars, obviously the fasting sugar is important for some. For most doctors, it's not. But if it's for your A1C, kidney function, electrolytes, you do not need to do a fasting. You can do a random or any time during the day blood set. That's important. And the other important thing to mention is, how are you going to get the request over to your lab? A lot of the times, patients just say, just fax it over. Pre-pandemic, labs didn't really have to deal with all this paperwork. So what's happening now is all these doctors' offices and nurse practitioners are sending over paperwork, lab requisitions, and they can't put them anywhere. So oftentimes they get misplaced. So after waiting in line for an hour, you get to your turn comes and they're like, we have nothing for you here. So I think that one of the best ways to ensure you have that you have everything prepared is either request it to be emailed, mailed to you. Those are the two, or just pick it up. I think those are the best ways to have that issue sort of sorted out. Vital signs, so blood pressures and heart rates. Typically, you wouldn't really need to keep a blood pressure or heart rate diary, because you would just come into the office, or you would go to your pharmacy, or whatever the case may have been. Now it's a little bit more challenging. Yes, you're being seen for diabetes, but blood pressure and heart rates play a big role as well. It tells us a lot about a patient: dehydration, volume status. So they're about $40-50 for a arm cuff one. Don't get the ones that are on your wrist. They're not as accurate, and sometimes they're more expensive. If you can get a arm cuff blood pressure device, they're about $40-50, and you can keep a really good, and they last forever. And you can keep a blood pressure and heart rate diary for your family doctor or your specialist or your nurse practitioner. I always ask my patients to try and keep a week's worth, or maybe a few days worth, a blood sugar log. I like to see readings before meals and before bedtime. I think those are the most valuable. And patients don't need to do this all the time, but it's really important just before the visit, just to get a general sense. It's oftentimes less helpful if a patient says, yeah, my blood sugars are controlled. They're great. They're fantastic. If I need to make any titration or look back at my records, that doesn't mean anything. It's not helpful. So oftentimes, if patients can keep a blood sugar log for sugars before meals and before bedtime, it really helps with making medication changes. There's traditional glucometers or devices to check your sugars. There's the continuous glucose monitoring or fast flash glucose monitoring systems. These are just some pictures of various different ones. For the most part, they all do a great job. There's sensor ones. There's ones where you can upload onto your phone. The bottom line is have one, use it regularly, and have it available for review if someone needs to see your sugars. These newer ones hook up to phone apps and can synchronize with your cell phones and glucometer. Examples are One Touch Reveal, Contour, diabetes apps are available, Dexcom, Freestyle. There's a lot of different kinds, and if you're on insulin, a lot of these fancy ones get covered, and you can get one of the up-to-date ones, and so that's important. Your doctor might, like I ask my patients, for example, to upload their data. So for example, with the Freestyle Libre system, there's something called LibreView. This is just a snapshot, no patient information's on here, but you can see that this information is available to me along with a whole lot of other information where you can see daily graphs and averages and targets and these types of things. So when I'm making a meaningful decision for your diabetes, I have all that information. You don't have to calculate percentages and draw fancy pictures for me because it's all being done. So it's even if you're controlled, it's good to have this type of information available. So I'm going to be honest, maybe before the pandemic, I wasn't really utilizing the technology that's available to us. And since the pandemic, I have been doing that type of integrating and using it. The latter half of this talk, we have a few minutes still. The latter half is going to be tips and tricks. What we've learned, and a lot of this information is on the Diabetes Canada website, but what we've learned and just summarizing everything. So, gathering contact information for your doctors, clinic, pharmacy, some of you have supplemental insurance, having all that information handy in one place when you need to. Oftentimes when you're doing phone consults or Zoom consults or virtual consults, you don't have everything available to you right in front of you, and you might get a little bit nervous trying to look for everything. And, so getting all that information right in front of you is very key. Writing down the names and doses of your medications. A lot of the times patients have sometimes a misunderstanding that we as physicians and practitioners have a list of everything. In all honesty, we only have what you tell us. So if you never told me about X medication before, I don't have it on my list. Blood work's different. We can pull your blood work from the computer, from the internet, but medications, we rely heavily on what you tell us. During this time, anything could happen. You might enter a lockdown again, right? Or there might be imposed restrictions. Just make sure you have enough medication for at least 1 to 2 weeks in case you can't get to your pharmacy to refill your prescriptions. Most of the time, the pharmacies do an excellent job, but you just want to make sure you just check your refills and make sure you have enough. I know that earlier on in the pandemic, there was only 30 days supply of medications that were being filled. You do what you have to do during those times, but now that we're a little bit more used to things, making sure we're up to date with everything's key. Supplies are a big thing. Pump supplies, pen supplies, monitor supplies. These are all things that, when you go or speak to your doctor, make sure you check off all these things and make sure you have them and have enough. refills we already spoke about. Extra supplies like rubbing alcohol, hand sanitizers, soap to wash your hands. That's important. It's also important to keep simple sugars like glucose tablets. If you need to treat your sugars, low blood sugars, oftentimes if you're ill, God forbid, if you get COVID, you might be ill and you might not be able to eat the same things, and you might have low sugars, hypoglycemia. You need these simple sugars to act quickly. Glucagon. So if you have a very, very low sugar, you need to have a glucagon kit oftentimes, and these are available at your pharmacy as well. Ketone strips are another very valuable piece of technology, especially if you have type 1 diabetes, irrespectively. So when a diabetic becomes ill, you might have heard of it. It's called diabetic ketoacidosis, and it's when your sugars just start going so high that the sugar starts to turn into a ketone. It makes you very ill. It's like the worst hangover of your life that you can die from. It's horrible. And oftentimes patients need to be in the ER, in the ICU, sometimes on a ventilator. So when you're getting sick, you can actually test for ketones, not only for the keto diet, which I don't recommend, but when you're ill, you need to check for ketones as well. And these strips are available. So this is a controversial topic, but which vaccine is safe for people living with diabetes? This information is directly from Diabetes Canada's website. There's no single vaccine that's better for diabetics. Diabetes Canada encourages all patients with type 1 or type 2 diabetes to get a vaccine when it's accessible to them. The benefits of any vaccine outweighs the risks that could be associated with it, especially getting COVID-19. And all the vaccines approved in Canada have shown to reduce the risk of hospitalization, to reduce the risk of severe illness and all death due to COVID. And then people with type 1 and type 2 diabetes were all in these trials. They were all scattered without these trials, and there was no special adverse issues that were seen. Obviously, people that had diabetes, things like elevated weight, other chronic illnesses, did unfortunately do worse because of an illness. But there's no special, nothing special that you need to worry about when it comes to a vaccine. I have diabetes, and I think I may have been infected. What do I do? With any illness, a diabetic can get more severe symptoms. Just like older folks and those with chronic illnesses. So what you want to do is monitor your sugars more often during this time of illness. Make sure your nurse practitioner or your doctor knows that you're sick. You might not need to go to the hospital or anything, but just let your doctor know. It might be as simple as leaving a message on their voicemail or whatever the case is. Because there might be some advice, staying hydrated, having enough unsweetened drinks on hand, eating smaller meals. But for the most part, diabetes, you've heard of SADMANs, I hope. And when you're sick, you need to stop certain diabetes medications and blood pressure medications, and you need to be put on insulin temporarily. Because these diabetes medications and blood pressure medications, because of the way they work, they can cause dehydration, and they can oftentimes affect your kidneys negatively. Normally, these medications are beneficial. They keep your kidneys healthy. They help with your blood pressure. They're good for you. But when you're sick, when you might be dehydrated, they oftentimes can affect you negatively. So these medications, sulfonylureas, a common one coming to mind is dimicron or gliclazide, angiotensin converting enzymes like ACE inhibitors or ARBs, diuretics, metformin, ARBs or angiotensin receptor blockers, non-steroidal anti-inflammatory drugs. So just to go back, angiotensin receptor blockers are a type of blood pressure medications that end in sartan, candesartan, irbesartan, and then the ACE inhibitors, the second A is like the Pril medications. or Coversil, enalapril, ramipril, these types of medications. Advil, ibuprofen, naproxen should be avoided, and SGLT2 inhibitors should be avoided temporarily. These are all medications that you should temporarily stop if you're very, and then your medications might need to be replaced with insulin just until you're feeling better, because those insulin does not cause dehydration and negatively affect your kidneys. So SGLT2 inhibitor is just an example. Jardiance, Forxiga, and Invokana are SGLT2 inhibitors. We're getting to the end of our presentation here. A common question I get is diabetes something that we can prevent? Is prevention of type 2 diabetes possible? Type 2 diabetes possible? And the answer to this is yes. You can prevent or delay or control type 2 diabetes, absolutely. You can reduce your chance of developing type 2 diabetes. And the number one thing you can do is controlling your weight and exercising and controlling what you're eating. This is the most powerful thing when we're in medical school and when we're in school. The number one thing that we're taught is there's nothing better than diet and exercise. If you need medication, you need medication, that's aside. But the most important thing is diet and exercise. Oftentimes we quote and tell patients 5 to 10% body weight reduction can mean reduction in medications. So even after you develop type 2 diabetes, losing weight and exercising can improve your sugars, and sometimes it can even, get rid of medications. I've had a lot of patients of mine, thankfully, that have been doing diet and exercise, and I've been cutting back their blood pressure, their cholesterol, their diabetes medications, and it's 100% possible. So I kind of zoomed through everything, and I hope that you guys all found this helpful, and thank you.
Thank you so much, Dr. Handa. We actually have a couple of questions in the chat if you're okay to answer them.
Absolutely.
Okay, so we have one from Mark, and it says, once you lose the ability to produce insulin, is it possible to get some or all of it back?
A fantastic question. So in a type 1 diabetic situation, that the likelihood you're going to be able to regain that function is very slim. So when someone it depends on how you're diagnosed with diabetes. Oftentimes I do ICU medicine. So if there's a brand new diabetic, someone comes into the emerge, is very sick, they get diagnosed with DKA, that person's pancreas is in shock. They're not going to be making insulin, or they're not going to be making enough insulin. And temporarily, that I tell those individuals that you're going to need to be on insulin. But after some time, after the initial shock goes away, those folks can get on medications, certain medications, and their insulin needs can go lower, and maybe they can come off too. In a type 2 diabetic, the example that I gave over time, that's an extreme situation where you fast forward, you have an eventual decline. A type 2 diabetic never really stops making insulin. It's just the amounts of insulin get to the point where it's not having a favorable effect. And a type 2 diabetic may have what we call fat cell or adipose tissue related, insulin blocking, or the effectiveness of insulin goes away. So weight loss oftentimes helps with getting them more responsive to their own insulin. So I hope that answers the question. I think it does.
Thank you. Okay, so the next question is, oh, it just shifted, sorry. Would our doctor know which meds we should be on just from our A1C reading?
Yeah, so I think in medicine, there's obviously a wide variety of different illnesses in medicine, but I feel like diabetes is one of those illnesses that thankfully we've understood, and we know we have a good algorithm for the most part. So there's a variety of different organizations in North America and in Europe that have algorithms available to anybody. They're even available to patients, but you can see, depending on your diabetes control. So let's say your A1C is 8, and you're on just metformin. We have algorithms and recommendations available for family doctors, nurses that say, okay, look, if you're just on metformin and this patient has X, Y, Z, they should be on these medications. This should be your next option. The problem arises when patients have had diabetes for so long and they're on these older medications. Oftentimes, these medications just stick on, and no one changes them. So I think that that's a problem. That's where patients can get educated and be more proactive and attend things like this and understand that, look, there's medications now that can help me protect my heart. There's medications that can help delay my kidneys from getting bad, and bring it up to your doctor. Your doctor, like when I do diabetes care, or when I see patients, it's oftentimes just for blood pressure or after a heart attack or thyroid or diabetes. Your family doctors and your nurse practitioners are going through a whole list of things for you, right? You might have 10 things. So oftentimes it's helpful if you tell your family doctor or nurse practitioner that, look, these are things that are important to me. And your family doctor and nurse practitioner might say, we'll address these, and then you need to come back and we can address all these other ones, because it's not simple. And one other thing, I know I'm taking a lot of time, but I'm sorry. One other thing that I'm going to say is a diabetes education center is so helpful. Sometimes I forget things, and I get a note from my diabetes education center and saying, hey, we recommend this, like this patient should be on this. And they do a far better job at following up on guidelines and things like this than some doctors and nurses do. So if you're not, I think most of you that are on here are probably a part of a diabetes center. But if you're not, if you know of someone that isn't, try to get them hooked up with one. It's very helpful.
Thank you.
Thanks.
Next question, we have a couple more.
Okay.
For extreme obesity, do you subscribe to the use of medications such as Saxenda, equivalent to liraglutide?
Yes. So I also practice, I do obesity medicine, medicine as well. So I think that medications like Saxenda, there's medications like Contrave. These are fabulous medications that, not every medication is suitable for every patient, but you should talk to your doctor about them. Sometimes Saxenda is a weight loss medication, but it has cousins that are very similar that are used for diabetes. So Saxenda might not be right for you, maybe, or it might be right for you, but it might be $500 because you don't have coverage. But things like Ozempic or Trulicity or different medications might be available and covered for you because you're a diabetic. So that's a fantastic question. And if you're here, you're probably a diabetic, and you don't need to worry about Saxenda because there's GLP-1 receptor agonists that are approved for diabetes, and you can get on those with similar outcomes.
All right, so the next question, same gentleman asking to get a copy of the PowerPoint presentation afterwards.
Sure, yeah, I can. What I'll do is I'll give a copy to you guys, and you can give it to whoever is interested.
Next question is, why is it a good thing not to need medication?
Why is it a good thing not to need medication? Okay, that's a great question. So you heard me talk about getting off of medications, right? That's one of the things that I believe in. There's something called primary prevention and secondary prevention. So Secondary prevention is where you've had a bad thing happen, like a heart attack, stroke, you have what we call peripheral arterial disease. If you know of someone that has had a heart attack, they go from 0 medications to like 8 medications in one day. And the reason behind that is these medications are proven in studies to prevent recurrence of that bad thing and overall improve quality of life. That's our main thing. We don't want this bad thing to happen again to this person. Whereas, like, for example, a patient that I'm going to say just has cholesterol problems or just has diabetes, but they've never had anything bad that we know come out of that. That's called primary prevention. And in that person, evidence shows that if you can get those individuals' cholesterol, blood pressure, diabetes controlled, you don't need to keep them on those medications. Controlled meaning like you take them off and they're fine, right? You don't need to keep those patients on medications because quality of life and life expectancy isn't prolonged in that situation. So if you have had something catastrophic happen, like a stroke, heart attack, you're probably going to be recommended to stay on a certain cocktail of medications. But when it comes to, just primary prevention, come off these medications. Every pill has some sort of side effect. If we don't have to use pills, don't take them.
All right, 2 more. You're doing really good, Dr. Handa. Do oral medications lose their effectiveness over time?
Oh, this one's good. So no. So diabetes changes. So I'm assuming this is oral medications for diabetes. So over time, your body changes, right? You might lose weight, you might gain weight, you might stay the same, but your water content might go up, your muscle mass might come down, your fat might go up. Things change. We look different. I don't look like, actually, I haven't changed that much. Actually, in this year I've changed, but what ends up happening is your pancreas changes over time. For some folks, the pancreas changes over time as well. So you're producing less and less and less insulin. So what happens is metformin might have been okay for you from 2010 to 2019, but then your sugars start coming up again. And it's not that the medication's not working, it's just that it's not enough at this point. And you need just another, because to be honest, I don't know if anyone's told you this, but no one really knows how metformin works, right? So, but whatever it does, it loses, it's not losing its effectiveness, it's just not working as effectively for your situation. So what you need to do is you need another maybe way of getting your sugars controlled. You might need a pill that makes you pee out more sugar. You might need to modulate your hormones a little bit by way of the GLP-1 class, receptor class. So over time, I always tell people, if you're on the same medications for diabetes for more than a few years, there's something like you need to just look into that. It's highly unlikely that you can go on 5 years without needing some adjustments.
Next question, once diabetic, always diabetic?
Yes, just because, like, it's just like saying once you've had just because you're on pills for blood pressure doesn't mean you don't have blood pressure problems anymore, right? So once a diabetic, you're always a diabetic because you're always going to have that chance of worsening sugars, right? So if you were diagnosed with diabetes 10 years ago, but you've done really well exercising, you're not on any pills, you still have diabetes, but it's controlled. It's controlled with diet and exercise. I always put that diabetes controlled with diet and exercise. That never leaves the list. And the reason why that's important is because I saw a patient today who actually came into the hospital yesterday, and his sugars were in the double digits. And he was not taking any medications, but the fact that this patient told the ER doc that he is a diabetic and he was on medications at one point doesn't come to a shock as to the doctor. It's just that something's changed, and their sugars are up now, but it's not a new diagnosis of diabetes. So they're not treatment naive. They can be put on medications, and now for however long they're going to need medications, but they might get to the point where they can come off again.
And it looks like we have one more. How does one go about getting a referral to see you for diabetes and or obesity?
So you can have your family doctor or your nurse practitioner refer you to me. If you don't have a family doctor or nurse practitioner, which is unfortunately quite common in the area we live in, then I'm gonna just recommend calling my office. We'll figure out a way. You need to see somebody, right? So oftentimes people go to the computer docs, like the ones on like a walk-in, and then you can get a referral that way. Like we can make it work. For the most part, it's not a problem. You should have access to care. And it doesn't have to be me. It can be anyone. But unfortunately, I can't just start taking care of you. You have to get a referral. But the referral can come from. I've gotten referrals from pharmacists, and it's not directly from the pharmacist, but at least I'm aware that this patient needs someone to take care of their diabetes, and we can always figure out a way. And you can Google my office number and everything.
All right. Thank you so much, Dr. Handa.
Thank you.
Also, we'll just say as well that the Port Hope Diabetes Clinic is now collaborating with Dr. Handa for diabetes. So if you're connected with our clinic or you want to get connected with the Port Hope Diabetes Clinic, we can also help arrange referral as well. So just so you know that too. So next up, we have our little kind of stretch yoga break. So everyone can kind of take a minute to stand up and stretch, and let Ursula lead us with some lovely, calming, relaxing chair yoga.
So I'm just going to give you guys a little bit of a background on Ursula. So she has a lifelong passion for health and fitness, and that led her to pursue her bachelor's of health science. And then she actually decided that she wanted to go back to school, and now she's working on becoming a registered nurse. So Ursula, over the years, has had many different roles in rehabilitation clinics and teaching community exercise classes and education programs. Ursula achieved her dream of becoming a yoga teacher in 2018, and her goal in her yoga classes are to help her students understand and appreciate the mind-body connection. Her favorite yoga pose is Funky Flying Crow, and she sent me a photo of this, and I am very impressed. I don't think I will ever achieve that position. So you can Google it. And she has a dog named Sultan, and her cat is named Leonard. So now I'm going to pass it over to Ursula. And again, thank you to our bronze sponsor, Essentia Diabetes Care, for featuring this chat.
Thank you very much. So good evening, everybody. It's an absolute pleasure to be here. As we saw in the presentation, there are a number of key management strategies when it comes to diabetes. And in particular, the exercise and stress management are two really big ones. And the beauty of yoga is that it helps us target both of those. So yoga is really a fusion of a number of different elements. It's not just the postures and the physical side of things, but we really get into the breathing, the meditative, the mindset. And in general, it helps us to create more of a conscious connection with our bodies, which helps us to listen and learn from our bodies. We can hear what it has to say. And then obviously the physical component, we know how much physical activity helps with regards to having a positive effect on reducing things like our A1C and our blood glucose. It helps with our blood pressure. It strengthens our bodies and our minds, and it's going to help with mood and sleep and everything else. So there's lots of benefits to yoga. So I am just going to, I've got my chair here behind me, so I'm just going to shift over there. Sure you can see me too. All right. So all of our postures that we're going to be doing can certainly be done from the floor and from a standing position as well. But the benefit of a chair is that it can make things extremely accessible. And you can utilize it throughout your day as well. Maybe if you're at the office or your home office these days, or maybe even sitting on your sofa in the evening with your Netflix of choice, we can break from there as well. So what we're going to begin with today is just bringing ourselves toward the edge of whatever we're sitting on, and we're bringing our feet right underneath our knees here so that we can ground down into those feet. So you want to feel the full sole of each foot, letting your hands just gently rest onto your thighs, thinking about lengthening up through the crown of your head. And if it's comfortable with you, maybe you're going to soften your gaze or even close your eyes just for a moment as we take in a few deep breaths. And when I say deep breaths, there's absolutely no need to change your breath, no need to suck in a deep, full breath, but just to feel that breath settle. As soon as we start to bring our awareness to our breath, you'll feel it just naturally become a little fuller. It's with these first few breaths that we get to begin to draw our awareness into our bodies, to see how we feel after our long day. And very gently, we'll just allow our chin to sink toward our chest, beginning from the top of our body, starting to release some tension through our neck. So we're just letting the weight of the head gently draw us into that stretch. And slowly we can start to let that chin take a little roll from side to side. Just waking up all the muscles along the back and the sides of the neck. And taking a pause in center there. Slowly bringing that chin back up. And with your next breath in, we're going to take a deep inhale, sending those hands up overhead, stretching through that core and through your arms. And exhale, release your hands down by your sides. Beautiful. With an inhale, big stretch up, lengthen out through those fingertips. Audible exhale, let go of the breath, let go of the arms. Take a pause. Let's bring our palms back onto our thighs. So we're going to bring a little bit of flexion and extension into our spine. So our cat and cow. We're going to take a nice deep breath in. And on an exhale, we're going to scoop out the belly, round through the shoulders. Let your gaze come toward the floor. And then on your inhale, draw that chest between your hands. Lift your chest, slight lift of your chin, finding a little back bend. So we exhale, squeeze out that air, rounding through the spine. Inhale, finding our little baby back bend. And we'll go again, one more time. Exhale. Inhale. And then just release to a neutral spine. Take a little pause there. From here, finding some twist in our body, we're gently going to take our left hand toward the right leg as we bring our right hand to maybe touch the back of our chair there. Think about spiraling from your belly and from your chest. And then we're going to sweep all the way through center, right hand onto the left thigh, left hand just reaching back gently. And then we'll come back to center, pause here. This time we're going to twist again, but bring in some more opening for the chest and shoulders. So we're going to take those arms out in front, shoulder height. And with a nice inhale, we're going to inhale that right hand up and over, all the way, explore the shoulder range of motion. It might feel like quite an opener. And then exhale that hand back to center. And we're going to switch. So now we're inhaling the left hand up and over. And then release back to center. We'll lower those palms, take an opportunity just to roll those shoulders. Maybe a few in one direction, and then a few in the other. And we're just letting all of that tension in our upper body go. Beautiful. Take a moment just to breathe. Again, to feel that body. We're always keeping that connection, checking in, letting our body be our guide. So for our next movement, we're starting to shift our way down the body, coming into our hips and our legs, another area that we hold a lot of tension. So with those hands on our thighs, inhaling some lift and length into that spine. We're going to exhale and start to fold forward from those hips, sinking your belly and your chest towards your thighs. Now, depending on your comfort here, you can keep your hands on your thighs, or maybe you're going to let them extend down toward the floor. Pick your option here. Just letting go of the weight of the upper body and the head. And then let's bring our hands back to the knees if they were extended. And we're going to roll up that spine. So press into your thighs. Begin to stack your vertebrae one at a time, letting your head, neck, and shoulders be the last thing to come up. No rush here. Fantastic. Let's take those feet, and this time we're going to step them open a little wider, slight turn out from the hips. And we're going to find that forward fold again. So first, lengthening through the spine. Then on your exhale, fold deep from your hips, sinking forward. Again, you can have those hands on the thighs for support, or maybe they're going to take a little stretch toward the floor. See what feels available to you. Just breathing into any tension that you might find in your hips. Enjoying that slight inversion. They have a nice way of reducing our heart rates. And then we'll take those hands back onto our thighs. Again, let's roll up that spine one more time. Feel the space and the length of each and every vertebrae as you come up nice and tall there. Always pausing to breathe at the top. Now, depending on what kind of surface you're sitting on, if you're on a chair like myself, I'm just going to give myself a little push back. So I've got a bit more of my bum on my seat. And I'm going to take those feet and step them just a little bit wider. So you're opening into a really wide stance here. Again, turning out from those hips. So you might feel a little squeeze in through those glutes. You can even ask your hands to just gently open up here. It's a big posture in yoga. This is our goddess pose. So it's really fully opening that pelvis, and we want to zipper up through that core to stay supported. We're going to take a nice deep breath, and those hands are going to come up toward the sky. Feel a full opening through your body. And then we're going to take that right arm. Sweeping toward the right leg, we're going to land either the hand or maybe the elbow as we take our left arm overhead into a side bend. So we're really stretching up through the rib cage and through the armpits. As you extend through those left fingers, think about keeping your left bum cheek glued to the chair. And then you're going to press into that right leg, come up through center, and we're taking it to the other side. So again, either the hand or the elbow sink into that beautiful side bend. Excellent. So we're going to do one more to each side, inhaling up and over. Take your time to experience that stretch. And then we'll take it to the left one more time. Nice full breaths. Breathing in between those ribs as well. Feel how it lengthens you out. And then we're just going to gently release up to center, sitting nice and tall. And we're going to wriggle or step those feet back towards center. And we'll take a pause there. Excellent work. So since we shifted back slightly for our goddess pose, take a moment just to make sure you're toward the edge of your seat again. We're going to re-ground through those feet. So making sure the feet are right underneath us, our knees are stacked over our ankles, and we're going to do a little bit of sit to stand practice. So this is an absolutely fantastic move, especially because it's functional in our everyday, whether we're getting up and down from our desk, up and down from the toilet, or up and down from the couch. All of these are really requiring a lot of strength and a lot of stability. And when we practice it in this manner too, we can get a little bit of those cardio benefits as well. So we've got ourselves positioned onto our edge of our seat and with our feet underneath us. We have a few different options to power up this movement. So if you have arms on your chair and you need that little boost from the arms, that's great. Or you can have your palms on your thighs to help with a little boost. Or you can bring those hands sort of up in front of you here. I like to just kind of grasp one fist, feel strong. And then what we're going to do is we just take a slight lean in the upper body, which puts the weight into those feet. We're powering up our thighs, pressing into those feet. We're coming up to stand. So slow and steady, we press up nice and tall. Take a pause at the top. Always make sure you feel comfortable when you rise. We're going to have a little peek over our shoulder. Just make sure your chair is still there. It's a really funny thing, but the first time you do this, it's almost going to feel like it's not there, but it is, I promise. So now as we come back into that seat, we're going to soften our knees, sit our hips back, aim that bum for your chair. I know you're looking. There you go. Find your way in. Perfect. The next ones will feel better, trust me. All right, so we're positioned. We know the movement that we're doing. Let's go again. Inhale, press up to stand nice and tall. Then exhale, bend your knees and sit back. Beautiful. Here we go. Inhale, stand tall. Maybe give a little squeeze of those glutes at the top. Then exhale, sit back, nice and slow and controlled on your release. We don't want bumpy landings. Excellent. All right, here we come. Standing up tall again. This time you have two options. You can either sit right back into that chair again, or maybe you're going to hover your bum. So pick your challenge. So with bending the knees, sit the hips back. Maybe we're going to hover over that chair. Maybe you're going to land, your choice. Keep those thighs strong. And then push up tall. And again, sit back, landing or hovering, your choice. Feel some heat in that body. Hopefully you're breathing nice and deeply. Press up, stand tall. I promise you've got just one more here. Let's sit back, hover in that bum. Big breaths. I hope your cheeks are flushed. And then you can release into your seat. Beautiful work. Take a moment just to breathe. If that heart rate is elevated, take a few nice, deep, full breaths as you release some of that heat from your body. Allow yourself to maybe listen to those breaths. There's something very therapeutic about really, truly letting go of a breath. And you'll feel quite quickly how just a few conscious breaths start to bring that heart rate back down once again. So from this position, we're now going to fire up a little bit more in that lower body. So we're just going to engage in some heel raises. So we're going to push up towards our toes and then land it down. And we can push up and release. So each time you push toward the top, think about that little bit of a squeeze in your calf muscles. This is such a great pose or movement because it's firing up those muscles and helping to shift our blood flow back up from the lower body. So just squeeze it out here. We'll do 4 more. 2 more. Beautiful. Release those heels. We're then going to take our right leg. Let's extend it out, landing on that heel. First things first from here, we're just going to think about actively drawing those toes towards us. So imagine you had a little string and you're going to draw those toes towards you. You'll feel a nice little stretch into the calf, which we just worked. And then think about growing that spine tall once again. We're going to take our right hand up toward the sky, extending and bringing more length into that body. Left hand just rests on the thigh, and then we're going to take a little bow forward. So just sinking deep into those hips, lengthening those fingertips towards your toes, whatever that looks like for you. All the while still thinking about drawing those toes towards you. Should feel a beautiful stretch up the back of that right leg. And then just rolling your way out nice and slowly. And we'll step that right foot in towards us. So let's switch sides. So now taking that left heel out in front. Pause there as we begin that active stretch, that drawing of our toes towards us. And then we lift and lengthen through the spine. This time it's our left hand, so we're extending that tall to the sky. Exhale, fold from those hips. Just gently explore that stretch, whatever it might look like this evening. Just breathing that length into your body. And then let's roll up and out. Bring yourself up tall, stepping that left foot back onto the floor. And we're going to come into one last deep hip opener here. We've got a couple of options for this. So we are going into our figure 4 stretch, and you'll see why I would call it that in a moment. Now we want to listen to all 3 of our joints for figure 4. So we're listening to our hips, our knees, and our ankles. If at any point it seems like it's not accessible, we have another option. So if you want to take the slightly easier option, the gentler option, you're just simply crossing the ankles out in front of you, and you can feel a little bit of a rotation in that hip. If you feel comfortable to try your figure 4, we're going to take our right ankle and we're just gently bringing it toward our left knee. Now you can get those hands involved. So your left hand can hold on to that right ankle and your right hand can support your knee. So we're just gently drawing it onto the thigh. Now this might already feel like enough of a stretch for you, and that's excellent. Whatever level works for you. If you feel like maybe there's a little bit more stretch there, we're just thinking about gently opening that leg to the side. So it's a slight rotation of that right knee toward the earth. And you can let your right hand just gently rest. Even just the weight of your hand is enough to provide a little extra depth. And you're going to breathe into that stretch. This is a big opener for our hips where a lot of us hold some tension. Beautiful, nice big breaths. Just taking your time, there's no rushing when it comes to stretching. Anywhere from 15 to 30 seconds should really be a minimum to get deep into some of these tight areas. So wherever you are for this stretch, we're just going to gently release, letting that right foot find the floor again. And we'll switch sides. So now we're bringing our left ankle up toward our right knee, getting those hands involved to just gently help draw it up slightly. And again, your choice, you can support that left knee as much as you need to, or maybe it's going to gently open. It's a deep rotation from within that hip. And don't be surprised if one side is drastically different from the other. Big breaths. Taking a moment just to allow that stretch to happen. Maybe just giving a few words of encouragement to your body, to thank it for all that it does for you each day, to give it permission to now let go a little bit. Maybe you'll feel those tendons and muscles lengthen a little bit more. And then we can release that foot down to the floor, taking a little pause there, just grounding through those feet one more time, sitting tall. And we're going to take one last deep breath, and then we're going to sigh it out. I know I can't hear you all, but I like to think that you'll all be nice and loud in your own homes. So let's take a big breath in with those hands coming up. Inhale into that body. Release whatever you need. Exhale, audible. And you know what? That feels so good. We're going to do just one more. Inhaling up and letting go. And there you have it. Thank you so much, everybody, for having me.
Thank you so much, Ursula. I didn't realize how tight I was. Like, these stretches did me very good. Do you mind sharing with us? You are doing some classes through our center as well, virtual classes. Do you mind giving people a little bit of an idea when that is? And
yes, definitely. Yeah, so I am teaching some Zoom yoga classes for the center at the moment. They're currently being offered on a Wednesday. We have a 10:30 a.m. class and a 5:30 p.m. class. And it's very much a mixed class. I have a variety of different people that are joining me for this class. So lots of different levels and trying to incorporate in modifications. And if you just take a snooze on Zoom for an hour with me, I wouldn't know, and that's okay too. So it's whatever level you want to practice at.
Perfect, thank you. And I see here Kristen has shared some COVID whole health docs document. If you guys want to look at some chair yoga handouts. And yeah, is there anyone with any further questions for Ursula? You guys can enter it into the chat box. Otherwise, yeah, good.
Thank you.
All right, that was great. Thank you so much. I feel so tired now, but in a great way. But now I'm excited to introduce our last speaker for the evening. We have Brooke, which is a mental health nurse at our community health center. And we're very thankful to have her taking some time out of her evening to speak for us. So Brooke is a registered nurse with a graduate diploma in mental health and addictions nursing. She has also been living with type 1 diabetes for 21 years, so has a passion for exploring where diabetes and mental health intersect. Now, I have some really fun facts to share about Brooke, just to get to know her a little bit better. And Brooke, give me a thumbs up if I can share all of them. Okay, great. Okay, so she has 2 golden doodles who think they are humans. Her nickname was Arnold for a period of time because of her last name. In university, she killed a cactus, and is now a proud plant mom of 18 indoor plants. They are part of her home self-care environment. Her main hobbies are music and songwriting, yoga, and nature walks. And she has 0 movie memory. She could watch the same movie twice, no problem. So those are some fun facts just to get to know Brooke a little bit better. So I'm going to pass it over to Brooke now to share her screen and finish off our evening.
Thank you so much for having me. I don't know about all of you, but my cheeks are actually quite flushed. And I could feel that collective exhale. So thank you, Ursula, for that. I think I needed that before I could move into this piece. So here we go. Let's share this. Right, I think we're rolling. So I'm going to be talking about diabetes and mental health within the context of COVID-19. So we're going to try to cover how mental health and the stresses of diabetes and the pandemic all overlap, as Jen mentioned. As well, we'll look at how diabetes management and mental health or stress play off of each other. And then, of course, what are some things that we can do about it? So when we think about mental health, sometimes our minds jump right to mental illnesses or different diagnoses like depression, anxiety, PTSD, bipolar, ADHD, you name it. But really, it's far more than that. And mental health applies to absolutely all of us because it exists on what we call a continuum. And we're all going to land on there somewhere. So many different things factor into our personal mental health. This goes right back to childhood, even with how we were set up for life. What kind of coping strategies, either healthy or unhealthy, did we learn? Did we practice? And which ones are we using right now? Has there been any experience of trauma along the way? And then, of course, our social context, which plays a huge role. And when I say this, I mean, what is the environment that we're experiencing our life through right now? How are our relationships? How are our social supports? What's our sense of security with our food, our housing, our jobs? All of that factors into how our mental health is. So I'm going to read the World Health Organization's definition of what mental wellness is. And I just want you to kind of see where it sits with you. So mental wellness is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So is this you right now? Then there's this next layer, diabetes. So we're all here because we have some kind of relationship with diabetes. And we know that diabetes comes with this slew of responsibilities. And maybe these all showed up overnight, right? So for those of you living with diabetes, just thinking about during any given day, how often are you faced with a diabetes choice? Maybe when you wake up, before each meal, before you go to bed, there's 5 right there, and there might be many others that fill in those gaps. So this blue circle contains some of the main things that lead to diabetes being referred to as that second job, one you likely didn't apply for, but here it is, right? Which brings us to this overlap. And the overlap here to me is key because mental health is not separate from diabetes. There are mental health aspects throughout living with diabetes. They're not add-ons, they're not if you run into trouble, they're not signs of being weak or defective or not having enough coping strategies, but rather diabetes itself in some way. Living with diabetes can come with some fear, maybe fear of highs or lows, fear of complications, fear of judgment or stigma that's still out there. It comes with stress because of all of these daily tasks, but also with expectations from others, expectations that we have of ourselves, and then distress, which we'll talk more about a little bit later. And this is the feeling that we just can't do it all, being overwhelmed, being tired. I recently heard some statistics from a doctor, Dr. Michael Vallis. He said, it popped out to me, but he said 6% of the general population deals with depression. 11% of people that are living with diabetes deal with depression, where diabetes distress happens in 46% of type 2s and 53% of people living with type 1. So it's really the disease burden that carries the emotional weight here. And then this past year and a bit, of course, we slap on another layer, one which none of us were prepared for or expecting in any way. COVID-19, a worldwide pandemic. And with this has come additional day-to-day things that we have to think about, that we have to do and to not do in order to be safe. As Dr. Handa was talking about, it's changed the way that we access appointments, maybe how we order supplies or prescriptions, how we hear about the increased risk of people with diabetes if they were to get COVID. And mental health-wise, the pandemic has brought about some emotions that maybe we're becoming a bit more familiar with. So there might be a sense of threat in some way, threat to life as we know it, threat to jobs, threat to money, threat to safety. And anytime there's a sense of threat, this brings about emotions such as worry and anxiety. Very natural response to that. It brings about a sense of loss in some way, maybe loss of supports that we're used to having around us, loss of social life, maybe loss of loved ones, loss of normalcy in general. And where there's loss, there is sadness. So sadness is normal. And lastly, the COVID pandemic may have brought about some kind of sense of injustice. There's more rules, being told what we can and can't do, and this might bring about the emotion anger. So these feelings might be sounding a bit more familiar than they were even pre-pandemic, but these feelings are valid because of what we are going through. And it's all on top of our daily life as we knew it before, which may have been enough. But all of that whole spiel was to say it is normal, however you are feeling. Diabetes itself is a marathon. It's not a sprint. Some days you might be more passionate, motivated, 100% on board with everything. Other days, not so much. Washed out, tired, discouraged, sick of it. This is where that term diabetes distress comes in. So this is where those negative emotions become overwhelming due to the burden of everyday tasks related to diabetes. Guilt, doubt, self-pity, etc. This is normal, this happens, this is actually expected. And if this is something you're curious about or is kind of resonating with you, you can actually speak with your diabetes educator, as there are screening tools for this that will kind of give you a sense of where you are at. But just because it's normal doesn't mean that we have to leave it at that. There's no magic eraser or quick fix to take away diabetes stress, COVID stress, or life stress. That's all very real, but there are definitely things that we can do once we understand all those drivers. So looking at how mental health impacts diabetes and how diabetes impacts mental health, it's a relationship that goes both ways. So first of all, it's important to understand the stress reaction itself and how this impacts blood sugar. So when we're faced with a stress, whether it's something very real or whether it's something that's perceived, meaning that it's stressful things that we're thinking about or worrying about, our brain registers that the same way and our body responds the same way. So the brain tells our adrenal glands to start pumping out adrenaline, which is our get up and go hormone, as well as cortisol, which is our stress hormone. And what these hormones do is they actually increase the amount of sugar that's available in the bloodstream. Because if we're facing a threat, if we're facing a stress, then we're going to need that sugar as a quick acting fuel so that we can get out of there. So stress itself can lead to increased blood sugars. Stress might also impact what we have left in our tank to put into diabetes management tasks, because it takes a lot of physical and emotional energy to be stressed all the time. So our ability to cope with those daily diabetes demands using those internal and external resources is less, which might mean that we lean towards those unhealthy choices or those quick fixes just to get through in the moment. And what's common after that? That little green bubble there, feeling bad about it, which is quite a human experience. So when our blood sugars come in higher or lower than we expected or wanted, or if we leaned on that extra cookie after dinner because we just needed a quick way to deal with stress, we might feel guilt, overwhelm, and start saying some things to ourselves, such as, we should have done better, maybe we failed, we can't do it. Those negative self-talk stories might get going. And this in turn creates more stress. And if there's more stress, this then impacts the blood sugars and the diabetes management. And then this leads to more of those stories, reinforcing those negative emotions and feeling more physically unwell. We all have something called a stress threshold, which is how much we can take on before it's too much. So I like to think about this as a bucket. So all of the stresses, the added stresses in daily life are drops into this bucket that fill it at different speeds, different amounts. And our coping strategies, these are the things that drain out some of that water so that there's more space to take on more without it being too much, without that bucket spilling over. So just checking in, how full is your bucket right now? And do you have things that create more room in that bucket? What we want to do is break this cycle. One, by being aware of it, which hopefully with the things that we've talked about has kind of brought it to surface. And secondly, by targeting these different parts of the cycle so that we can actually stop the loop. So if we target stress, sometimes we think we have to do something really big to make a difference. But actually, the most powerful things with stress are the foundational pieces, the basics: food, exercise, sleep. So what is your nighttime routine like? How do you set yourself up for your day in the morning? What are you fueling your body with? As humans, we're designed to move and be active. Are we giving our bodies that opportunity? Exercise has a huge impact on all of the feel-good hormones that are in our brain, our serotonin, our dopamine, our endorphins. It has a natural balancing effect for those, as well as it increases the blood flow to our prefrontal cortex, which is our voice of reason, our decision maker, all of those critical thinking skills. We also have to recognize that stress is a signal and a messenger. So it's something that we have to acknowledge and respond to. Otherwise, it gets bigger, it gets louder. So why is the signal going off? And is it something that you can change and control? That's something to ask yourself in the moment. If it is, well, then you can make a plan, you can take action. So for example, I don't like that the COVID news is right in my face first thing when I wake up after my phone alarm goes off. So maybe I choose to turn my phone on airplane mode before I go to bed. And I choose to not turn that airplane mode off until I've had breakfast and I've had a chance to ground myself. So that's something I can control. Is it something outside of your control? Well, then it's more about managing our reaction and what kind of coping skills we can bring in to deal with it. So for example, I was planning to go for a walk today, but it's raining outside and I can't control the weather. So right there, you could sit back and be upset about that. But what's in your control is what you do inside. So maybe you've been putting off trying a workout video or an exercise class, a yoga class with Ursula. And this is a great opportunity to try that, which then shifts the whole mood of that. And then adding in stress reducing activities that move us out of that fight or flight or that stress reaction and into more of a calming state. So breathing, that huge exhale, meditation, mindfulness, yoga, getting outside in nature. Those are all kind of classic examples of that, but it's whatever soothes you. And this is just a part of the handout that you will be provided with that Diabetes Canada has put together that sums up those choices around stress management. Then we can target diabetes management. And I'm going to look at this in a bit of a shifted focus. So what positively impacts my blood sugar that I can add in? I feel that a lot of diabetes kind of feels like restriction, right? So thinking about it in a way of what can I add in? So exercise, what is movement that you enjoy, that you do not because you have to, but because it's a part of your self-care? Personally, this was a huge shift for me when I stopped exercising because I had to do it for my diabetes, but because I wanted to do it because of how it made my body feel, how it made my brain feel. With nutrition, experimenting with foods to make you feel full, nourished, healthy. So when we're adding in positives, they begin to crowd out these things that don't serve us, that don't serve our goals. So if we're eating more fiber, more protein, more healthy fats, more water intake, and filling our evenings with evening walks, playing with the dogs, whatever it is, there's simply just less space for those simple sugars, the highly processed foods, the alcohol, the being more sedative in the evenings. And then how can you simplify the daily and routine tasks to free up more time? So if we picture all of those things in that blue circle, there's a lot there. For me, my coffee making habit in the morning is a pretty strong one. So that's a habit I already have in place. So I have kind of layered on, I put my glucometer beside my coffee pot. So then I don't have to think about that in the morning. It's just right there. That's one decision I don't have to make. I'm making coffee, I'm checking my blood sugar. It goes hand in hand. So stacking habits is one way. Setting reminders for daily activities or appointments or medication refills, putting those right in your phone or on your printed out calendar so that, again, it frees up the brain space. Setting realistic goals, starting small and achievable. So maybe setting the goal of walking 5 kilometers a day is a little bit daunting. And if we're overwhelmed by a goal, then there's a high likelihood that we're not going to do it. I've fallen guilty to that one. I heard a story of a man who his goal was just to tie his running shoes every morning. And then it was to walk to the end of the driveway. And that was it. That was the goal. If he ended up going further, that's great. And guess what? It's kind of hard to stop that walk at the end of the driveway. But if you did, there's no feeling bad about it. There's none of that negative self-talk because that goal was met. So realistic goals. And using the resources and expertise of the diabetes team. That's where that fine tuning with all of the blood sugar management can come in. And lastly, we can target our reaction and our response. So recognizing if our expectations match what's actually realistic. One way to think about stress is as a tension between how we wish something was and how it actually is. So I want my blood sugar to be in target. It's often high. Stress. I want to manage diabetes well, but I'm having trouble. Stress. I want to see my family, but I have to stay home because of COVID. Stress. So stress is there when there's tension between what we desire and what reality is. Are you expecting perfection from an imperfect disease? Are you allowing yourself a little more grace, given the fact that we're in this worldwide pandemic and it's hard? With this also goes being aware of how we speak to ourselves. Language is so powerful, and there's so many words and sentences and thoughts floating around in here that we're not even conscious of. I'll give you 2 sentences, and I just want you to see how it feels when I read them, the comparison. Man, my blood sugar was 15. This is another example of how I failed. I'm the worst, I give up. Versus, well, today's not the best day I've had. Maybe if I go for a 15-minute walk after lunch next time, that might make a difference. I'm curious. There's a real difference in how that feels. And being cautious saying that you're fine if you're not fine. Can you say honestly, I'm struggling? Creating space for our emotions to come up, even if they're uncomfortable. Acknowledging it, where it came from, how it feels, and then deciding how to move forward and what attitude you want to move forward with. And the outcome is this new pattern, not to say that we won't loop back, because we will, because this is an ongoing process. But how we treat ourselves impacts our blood sugars, absolutely, directly, as well as because of how it impacts managing diabetes, all of those tasks. Our blood sugars also impact how we feel physically and about how we feel about ourselves and talk to ourselves. It works both ways. If we focus intentionally and daily at some level on targeting stress, managing blood sugars, and paying attention to what's rattling around in our minds, our bodies and our minds will both thank us. Can we focus on diabetes as a form of self-care? I care about my body and myself enough to be dedicated to taking care of my health and my well-being. Can we focus on self-care in general? What fills you up? Can we add in joy and playfulness, especially if diabetes was a focus in childhood? But even as adults, playfulness and joy are huge components of mental well-being. Can we enjoy the sweetness of life in a different way? So rather than focusing on that restriction, what can we add in that sweetens our life experience? Recognizing that you're not alone in any of this, not in the experience of this roller coaster of a year, not in the experience of living with diabetes. Be in this together. So to healthcare professionals, ask the questions. Diabetes distress is real. Listen non-judgmentally and recognize the many layers. To individuals living with diabetes, be honest, open up about what's going well, but also what's not going well. And trust that you'll be met not with judgment, but with a helping hand and a compassionate heart. So this is just, I'll show you some of the resources that either have been sent to you or will be sent to you. So this is a little form that I created to start by taking inventory. So checking in with how is your sleep? How's your nutrition? How's your mood, your self-care practices, your diabetes? For anybody that's visual and likes to write things down and have kind of a concrete plan, this is a tool for you. And at the bottom of this triangle is the why. Why is it important to you? What does diabetes management mean? What would better stress management and mental wellness mean to you? What would it allow? Building the foundation. So what can you do to improve sleep hygiene practices, make shifts in nutrition, adding in more meaningful movement? And who's in your corner? What are the supports? This might be people, friends and family. This might be professionals, diabetes teams, family doctors, specialists, mental health supports. It might be websites or apps that you lean to as your go-to when you're not doing so great. The diabetes stuff. What helps make management easier? How can you adjust how you talk to yourself about diabetes? And then self-care. What is it that brings you specifically joy? What fills you up? What makes your life sweeter? And I can't leave you without any resources. So this will also come in a nice, concise handout that will have more information. But top of the line, diabetes team is a perfect go-to for connecting to any of those diabetes related resources, as well as different mental health supports maybe in your area if you're not from here. Diabetes Canada, great website again with the diabetes resources. For system navigation, if you're having trouble connecting to certain community resources, Connex Ontario is it's a phone line as well as a website that can help to bring to light different mental health and addiction services. There's 211 Ontario, which again, you can just call that number and they can help to guide you which service would meet your needs. Bounce Back Ontario. This is a free skill building program for anybody over the age of 15. It's put on by Canadian Mental Health Association. And it's for people with low mood, mild to moderate depression, anxiety, stress or worry, just to learn some of those coping skills. It's a phone coaching and online video resource. There's Northumberland Hills Community Mental Health Service, where there's access to walk-in counseling or phone-in counseling currently. And then I've listed some different websites and apps as well that you might want to play around with, both mainly mental health focused. And these are what the actual handouts look like. So this is the resource handout. This is a little summary of the main points in the slides. That taking inventory and goal setting. And then the stress management steps by Diabetes Canada. And that's me. Thank you so much. And I just want to do a shout out to the diabetes team for all of the efforts that we can see today, but also all of the efforts in all of the background of all of this. You're all rock stars.
Thank you so much, Brooke. That was wonderful. So much helpful information, especially those community resources. So please know that you will be getting sent those handouts if you haven't already gotten them in your email. I just wanted to say one thing quickly before Kristen leads our wrap up here this evening. At our Diabetes Education Center in Port Hope, we also have social workers that are connected to our clinic. So if you're ever in need of any counseling or someone to talk to, there's no commitment or anything. If you just wanted to try it out, we do encourage it and we offer it. So don't hesitate to reach out if you are looking for that.
All right, so miraculously we are on time. So thank you to all of our speakers for sticking to the schedule. And I've loved all of the questions that you guys have popped into the chat box. This has been really exciting to have this time to connect with people. I know with COVID, we're all kind of missing each other, and normally our center is quite the busy hub. So I really miss seeing a bunch of you popping in and out of exercise classes and cooking classes. I know sometimes when I go into the centers on Wednesdays, I get to smell all the cooking that's going on, and it makes me really miss our cooking classes. So hopefully when the world is a little more normal, we can start doing some of those face-to-face programs. But again, just a little plug for some of our other services. So as mentioned, we have our yoga class, but we also have some other exercise classes that are offered virtually. And we have some other workshops from different programs that are offered virtually as well, mostly through Zoom. So if you go to our website and onto the program calendar, you can see all the information there. And then that was the main one there. Okay, and then the other piece was, I think this was already mentioned, but again, you can be referred to our specific diabetes program through your family doctor, your nurse practitioner, and we also accept self-referrals. So if you aren't currently a client of one of the diabetes educators in our center, then you can definitely give us a call. Our number is 905-885-2626, and our diabetes extension is 238. And our wonderful secretary, Kim, will take all of your information and then get you booked in with us. And then again, so from a service perspective with us, most of our appointments are offered by phone or virtually through a program called the Ontario Telehealth Medicine Network, which is a similar way to this, where we can actually see each other, which is really great, instead of having to do face-to-face right now, just to keep everyone safe. And then finally, if you have received your email from Kim, there should be a link in there for a SurveyMonkey evaluation form. So if you could take the time and fill that out and let us know what you enjoyed about this evening, maybe what you thought we could add on or maybe do a little differently. Hopefully next year we'll be back to meeting together at the Lions Center and having kind of more of a typical diabetes expo, but I don't want to jinx anything. And then if you do complete the evaluation, we had the Ganaraska Conservation Authority donate a membership for 1 year for just walk.